I got some bad news from the doctor. Your bones are tiddlywinks. You've been diagnosed with osteopenia or osteoporosis. Now what? Normally our bones have a hard sponge-like structure with tiny holes throughout, but with osteoporosis, those holes are bigger and create a less stable material that is easier to break or fracture. When I was younger, I did crazy things, but now I realize I'm not indestructible. Actually, I'm just the side of a pile of popsicle sticks. Osteoporosis results in bones breaking more easily, even from a minor fall, a cough, or in the case of one of my relatives, just walking around. The word osteopenia means your bones are in between normal and osteoporosis. So it's a warning sign of things that might come. More than half of US women over 50 will suffer a major broken bone due to osteoporosis. Being a woman and being over 50 are major risk factors for developing thinning bones. As if it's not bad enough to be over 50 and female, we weren't even able to talk about our own body. We had to learn silly nicknames for our own private parts. I call mine my puss. I call mine my love lady. I don't have a nickname for my parts. Sure you do, it's lonely. Hey ladies, cool it. I'm a retired disability doctor who has seen thousands of people with serious bone fractures of the hip, wrist, and spine. Many of my patients with brittle bones suffered severe pain and had to have major surgeries. Some never went home to live on their own again, being institutionalized, and the risk of dying in the months after a broken hip is still 20 or 30%, despite all the advances in modern medicine. So I know a thing or two about why you don't want osteoporosis to get worse. And I suffer from osteopenia myself. Thanks, Mom. There's an old joke about two friends talking. One says, "How's your mother?" And the other says, "Smaller." Your genes play a huge part, up to 85%, in how thick or thin your bones will be. As your bones get thinner, you get more frail. People are like soap. They get smaller as they get older. My mother and my grandmother, as they aged, they got shorter. And my grandmother was very bent over. Due to the loss of height of the collapse of the spine bones, they suffered terrible pain and disability as a result. I don't want that happening to me, and I don't want that happening to you. The good news, though, is even if you inherited thinning bones, there are things that you can do to change the course of the disease. Otherwise, it will get worse. You can often stop it from worsening with the right behavioral changes, and adding medications may even reverse the process. You may ask, do I need medications? That's up to your physician to decide with you. It may be your primary care doctor or a specialist in bone health, which is usually an endocrinologist, a rheumatologist, a geriatrician, or a rehab doctor like me. Remember when people used to dress up to see a physician? Yes, you're right. I should have worn a tie at my doctor's appointment last week. Then I could have used it to strangle him. Now you know what osteoporosis is and what osteopenia is, and some of the major reasons you may have developed it. Coming up, I'll tell you how you can prevent fractures and strengthen your bones.